Bismillahirrahmanirrahim. Quote of the day is: Never let the sadness of your past and fear of your future ruin the happiness of your present. Assalamu alaikum. My name is Dr. Momina Zia. I'm a PGR in Community Medicine Department. Today, I'm going to present the topic of schistosomiasis under kind supervision of my professor, Dr. Saira Afzal. The agenda of today's meeting would be discussion about the introduction and epidemiology, life cycle and clinical manifestation, diagnosis and management, prevention, challenges, and recent advances. At the end of this discussion, participants will be able to define schistosomiasis with its types, describe the life cycle and transmission, explain the epidemiology and global burden, discuss about the clinical manifestations and complications, know about the diagnostic methods and treatment, and they can outline the prevention and control strategies. Introduction. Schistosomiasis is a waterborne parasitic disease which is caused by schistosoma species, which are known as blood trematodes or flukes. It is classified as a neglected tropical disease, NTD, by the WHO. It affects more than 250 million people worldwide, mostly in Africa, Asia, and South America. Now, there are different causative agents which causes schistosomiasis. Number one is schistosoma hematobium, which causes urinary schistosomiasis. Number two is schistosoma mansoni, which causes intestinal schistosomiasis. And number three is schistosoma japonicum, which causes intestinal schistosomiasis. These are the eggs of schistosoma, different species of schistosoma. They can be identified on the basis of differences in morphology in their eggs. Now, they mostly, schistosoma, they complete their life cycle in human. The sexual part of the life cycle is completed in human, where it inhabits the gut vessels. Schistosoma japonicum is most frequently found in the superior mesenteric veins draining the small intestine. Mansoni, on the other hand, occurs in inferior mesenteric veins, which drains the large intestine. Similarly, schistosoma intercalatum and other species also inhibit the inferior mesenteric plexus, but lower in the bowel than Mansoni. Schistosoma hematobium most often inhibits in the vesicular and pelvic venous plexus of the bladder. The eggs are moved progressively towards the lumen of the intestines in case of schistosoma mansoni and japonicum infections, and bladder and ureter in case of hematobium infection, and they are eliminated with feces or urine, respectively. Now, this is a picture of adult male and female schistosomes. Unlike other trematodes, which are hermaphrodites, schistosoma species, they are dioecious, which means they have different individuals with different sexes. The lifespan of an adult is more than 20 to 30 years in males. The number of testes, they varies from 4 to 6 and are arranged in a cluster. However, in a female, the ovary is positioned in the middle of the female body, and about 20 to 30 eggs are present in the uterus. Schistosoma hematobium, it lives in the venous plexus of vena cava system that drains the urinary bladder, pelvis, and ureter. Both male and female flukes are found together. Now, moving on to certain terminology which we are going to use again and again as cercaria. This is the infective form of schistosoma hematobium. This is the structure of a cercaria which shows the cercarial body and a tail. The body consists of oral suckers and certain pre-acetabular glands and a ventral sucker zone, and tail is for contains the sensory papillae with a fork-like tail projection. So it has an elongated oval body and has two suckers and a bifurcated elongated tail measuring about 200 micrometer in length. The entire body is covered with extremely spine-like projections. They have a short life. They only live for about 24 hours to 72 hours. The male and female cercaria, they are morphological to each other in schistosoma species. Now, moving on to the epidemiology. The global burden counts for about 700 million people at risk in endemic areas. High prevalence is seen in sub-Saharan Africa. Estimates shows that at least 251.4 million people required preventive treatment for schistosomiasis in 2021, out of which more than 75.3 million people were reported to have been treated. So who are at risk? School-age children, fishermen, farmers, and people who come in contact with contaminated water. People are infected during routine agricultural, domestic, occupational, and recreational activities, which exposes them to infested water. So lack of hygiene and certain play habits of school-age children, such as swimming or fishing in infested water, or even washing clothes in infested water, make them especially vulnerable to infection. So the World Health Organization classifies Pakistan as non-endemic for schistosomiasis. Moving on to the situation in Pakistan, human cases in Pakistan, they are rare and are typically involve individuals who have traveled to endemic regions. For example, a 25-year-old male contracted the infection during travel to Malawi and was diagnosed upon returning to Pakistan. While human schistosomiasis is uncommon, animal schistosome infections they have been documented. Surveys in northeastern Pakistan reported a 7 to 21% prevalence of schistosome infections in cattle and buffaloes. Another study in Punjab region found prevalence rates between 13.6 and 17% in buffaloes. Now, the life cycle and transmission. First, have a look at this picture, and then we'll go through the life cycle stages. Number one is the eggs of the schistosome they shed from the infected human in the form of feces or urine. The urine contains schistosoma hematobium eggs, and the feces contains Japonicum, McCanky, or Manzoni eggs. These eggs then hatch and they release a structure which is known as miracidia. This miracidia then swim and penetrate the snail tissues. The snail is the intermediate host here, and the definitive host is man. So the intermediate host is very much necessary because here the asexual reproduction takes place in which the sporocysts they develop in snail. There is they kind of develop and then the free swimming cercaria they are released from snail into water. So this cercaria is the infective form which then penetrates the skin of the human. And then this cercaria it loses its tail during penetration and becomes schistosomiole. And this schistosomiole then enters into the circulation via blood. Hematological spread occurs, migration to the portal blood in liver, and maturation into adults. So the adult formation occurs in the portal circulation. So this adult is then paired adult worms migrate to mesenteric venules of bowel, rectum, laying eggs that circulate to the liver and shed in stools, or venous plexus of bladder, eggs and shed in urine, and the cycle continues. This is the transmission, which shows there is a source of infection. To get the infested feces, they were added into the water. From where the egg converts into miracidia. This miracidia penetrates the snail. Here it completes its life cycle and converts into cercaria, the infective form. The cercaria penetrates the human skin and completes its sexual development there. Now, the hosts, various animals such as cattle, dogs, cats, rodents, pigs, horses, and goats, they serve as reservoirs for Schistosoma japonicum. And dogs, for McConkie and Manzoni, is often frequently recovered from wild primates in endemic areas, but is considered primarily a human parasite and not a zoonosis. Now, the intermediate hosts, there are various genera of snails which act as intermediate hosts, including Bioflaria, Oncomelania, and Belinus. Now, schistosomiasis is the infection which is caused by schistosoma hematobium, japonicum, and Manzoni. It can be classified as acute schistosomiasis or Katayama fever and chronic schistosomiasis, or it can be classified as intestinal and urogenital. Schistosomiasis mostly affects the poor and rural countries, particularly agriculture and fishing population. Women doing domestic chores in infested water, such as washing clothes, they are also at risk and can develop female genital schistosomiasis, as described before. Now, moving on to the symptoms of intestinal and urogenital schistosomiasis. The intestinal schistosomiasis, it can result in abdominal pain, diarrhea, and blood in stools. On the other hand, hepatomegaly is seen and is common in advanced cases and is frequently associated with an accumulation of fluid, which is known as ascites in the peritoneal cavity, and hypertension of the abdominal blood vessels, which is portal hypertension. In such cases, there may also be an enlargement of spleen. Now, moving on to the symptoms of urogenital schistosomiasis, the classic sign would be hematuria, which is blood in urine. Kidney damage and fibrosis of bladder and ureter are sometimes diagnosed in advanced cases. And these individuals, they have a chance of having a co-infection with HIV, especially in women. In women, it may present with genital lesions like vaginal bleeding, pain during intercourse, and nodules in vulva. In men, it can induce pathology of seminal vesicles, prostate, and other organs, leading to infertility. Now, what is the pathophysiology? In case of intestinal schistosomiasis, pathology is associated with schistosoma manzoni and schistosoma japonicum. Schistosomiasis includes various hepatic complications from inflammation and granulomatous reactions and occasional embolic granulomas in brain or spinal cord. In case of urogenital schistosomiasis, pathology of schistosoma hematobium schistosomiasis includes hematuria, scarring, calcification, squamous cell carcinoma, and occasional embolic granulomas in brain and spinal cord. Now, the clinical presentation. The symptoms of schistosomiasis, they are not caused by the worms themselves, but they are caused by the body's reaction to eggs, and they're classified as acute schistosomiasis and chronic schistosomiasis. Acute schistosomiasis is also known as Kaziyama fever. It is a systemic hypersensitivity reaction that may occur weeks after the initial infection, especially by Schistosoma mansoni and Schistosoma japonicum. A local cutaneous hypersensitivity reaction following a skin penetration by Cercaria may occur and appear as a small itchy maculopapular lesion, identified as manifestations include systemic symptoms or signs, including fever, cough, abdominal pain, diarrhea, hepatomegaly, and eosinophilia. In case of chronic schistosomiasis, schistosoma infections, they may lead to central nervous system lesions. Like cerebral granulomatous disease may be caused by ectopic schistosoma japonicum eggs in brain, and granulomatous lesions around ectopic eggs in spinal cord may occur in schistosoma mansoni and schistosoma hematobium infections. Continuing infections may cause granulomatous reactions and fibrosis in the affected organs, like liver and spleen, with associated signs and symptoms. There are certain complications that can occur with urinary schistosomiasis. Number one is bladder fibrosis and calcification. Number two is hematuria. Number three is obstructive uropathy, which leads to the blockage of the urinary tract and can cause hydroureter and hydronephrosis. And then there will be an increased risk of bladder cancer, which is the squamous cell carcinoma, because of the chronic irritation and metaplasia. Similarly, kidney damage can occur, which occurs in long-standing infection and result in renal failure. So intestinal schistosomiasis can lead to hepatomegaly and splenomegaly, periportal fibrosis, which is also known as Simmer's fibrosis, in which the thickening of the portal veins wall occurs, leading to the liver damage and portal hypertension. Similarly, portal hypertension can result in esophageal varices, which may rupture and cause life-threatening gastrointestinal bleeding. And ultimately, ascites is also there, which is the accumulation of the fluid in abdomen due to the portal hypertension. Pulmonary schistosomiasis can also occur in certain cases when the eggs embolize to the lungs, particularly in advanced cases of schistosoma mansoni or schistosoma japonicum infections, which is the intestinal schistosomiasis. Now, the complications would be pulmonary hypertension, which is chronic egg-induced inflammation, can lead to pulmonary vascular damage and elevated blood pressure in lungs. And similarly, copulmonale can occur, which is the right-sided heart failure due to prolonged pulmonary hypertension. In some cases, neurological schistosomiasis also occur because of the ectopic sorry. Number one is spinal cord lesions, which is mostly with schistosoma mansoni and hematobium. Symptoms are paraplegia and cerebral schistosomiasis, which includes seizures and headaches. Other complications are ectopic egg granulomas in other organs, lungs, hearts, anemia due to chronic blood loss, and growth retardation and cognitive impairment in children. This is a sequelae of the complications, which has already been discussed. Now, the diagnosis. The diagnosis is mostly the detection of the parasitic eggs in stool or urine samples. It is the gold standard test, which is seen under the microscope. Number two is antibodies or antigens are detected in blood or urine samples. For urogenital schistosomiasis, a filtration technique using nylon, paper, or polycarbonate filters is the standard diagnostic technique. Children with schistosoma hematobium almost always have microscopic blood in their urine, which can be detected by chemical reagent strips. The eggs of intestinal schistosomiasis can be detected in fecal specimens through a technique using methylene blue stains, cellophane soaked in glycerine or glass slides, known as Catocad's technique. In schistosoma mansoni transmission areas, the circulating cathodic antigen, which is CCA test, can also be used. For people living in non-endemic or low transmission areas, serological and immunological tests may be useful in showing exposure to infection and the need for thorough examination, treatment, and follow-up. So treatment, the anti-helminthic drug praziquantel is being used specifically, and the dose would be 20 mg per kilogram, 2 doses in 1 day in case of intestinal schistosomiasis, and in case of urinary, it is 20 mg per kilogram, 3 doses in 1 day. There are alternatives in case if the person develops a hypersensitivity reaction to praziquantel. There are options like oxaliquine and metrophenate, but they are not very commonly used these days. Talking about the praziquantel safety, it is quite safe and effective in pregnant and lactating mothers also. So there are certain adjunctive measures that has to be used along with the main treatment. These are corticosteroids that may be used to reduce the severe inflammatory reactions. in acute cases. And symptomatic management address the complications such as portal hypertension or urinary obstruction in chronic cases. There are certain challenges with this drug treatment. There are drug resistance, there is a reinfection, and there is a limited access to medications. These are the challenges. Now, what can be done for the prevention and control? Number one is health education and community engagement. Awareness campaign educate the communities about transmission symptoms and preventive behaviors. Now, what are the behavioral changes? They promote the safe water practices and discourage contact with contaminated fresh water. Community participation will also be appreciated, which is the encouragement of the local involvement in control programs to ensure sustainability. School based programs target children, a high risk group, for educational hygiene and prevention. Number two is safe water supply and improved sanitation, access to clean water, develop infrastructure for piped or treated water supplies to reduce contact with contaminated water sources, sanitation facilities, construct and maintain proper latrines to prevent human excreta from contaminating freshwater bodies, and hygiene promotion is advocacy of hand washing and safe water use practices. Number three is snail control, use of molluscicides or biological control, introduction of natural predators or competitors like Marisa snails, or environmental management, modification of habitats to reduce snail breeding, such as drainage of stagnant water and vegetation removal, they would also be effective. Number four is preventive chemotherapy, or also known as mass drug treatment, MTD, frequental distribution, periodic mass treatment of at-risk population, particularly school-age children and fishermen. WHO guidelines are target prevalence threshold for treatment frequency. If the prevalence is more than 50%, then annual mass treatment with the drug is recommended. If prevalence is 10 to 50%, then every 2 years, the mass drug administration is recommended. And if the prevalence is less than 10%, then only the targeted treatment is recommended. Number five is integrated control strategies. Combine health education, snail control, sanitation, and MDA for maximum impact. Use collaborative efforts across sectors, health education, water management. Number six is surveillance and monitoring. Regular surveys, snail surveillance, and treatment efficacy would also be very effective. Number seven is international and national policy implementation. WHO's global strategies to reduce the disease burden and work towards elimination where feasible. So a national action plan is develop country specific policies integrating prevention, control, and public health infrastructure. There are certain case studies from Egypt, China, and Brazil, which shows the control of schistosomiasis and the impact. So in Egypt, a national control program was launched in 1977, which comprised of use of presequential health education, sanitation, and the prevalence decreased from 40% in 1960s to less than 2% by 2010. Similarly, in China, a similar program was launched in 1950s, where the health education, use of praziquantel, and biological controls were used, and prevalence reduced from over 11 million cases in 1950s to approximately 1 lakh cases by 2015. Similarly, in Brazil, a control program was launched in 1975, comprising of the similar steps, and then the reduction in prevalence from 16% in the 1970s to under 5% in many areas today. So what is the summary which have been seen through the control and prevention is by using preventive chemotherapy as a key intervention, praziquantel distribution significantly reduced morbidity of schistosomiasis has been seen. Similarly, partnership between health and education sectors is very important, like an integrated education effort improves the behavioral change. That a similarly decentralized approach like regional autonomy allowed tailored interventions. There are certain challenges in prevention and control. These are inadequate healthcare infrastructure, drug resistance concerns, environmental and social barriers, sustaining long-term control efforts, and there are certain research and innovations in this line, which is the development of vaccines, advancement in diagnostic tools, and genomic studies of schistosoma species, which can be seen in further articles. Moving on to the latest updates. Accelerating snail vector genomics. So an important step in the fight against schistosomiasis in Asia has been taken with the publication of the article Chromosome-Level Genome Assembly of Oncomelania, the intermediate snail host of Schistosoma japonicum, which means that the genome for all the three major genera, including species across the continents, are now available. Most importantly, the wealth of new genomic and transcriptomic data is helpful to establish the specific molecular mechanisms that underlie the compatibility between snails and their schistosomes which, although diverse and complex, may help to identify potential targets dictating host parasites indications that can be utilized in future transmission control strategies. This network on oncomelania and indeed studies on other snail vectors which provide deep insights into the genome will stimulate research that may lead to new and much needed control intervention. Number two is related to the vaccine, therapeutic and vaccinomic potential of moonlighting proteins for the discovery and design of drug and vaccines against schistosomiasis. So recently, proteins, they have been mentioned as targets for drug discovery and vaccine development, especially those with multiple functions in schistosomes. Moonlighting proteins are a class of proteins that can perform several functions besides their known functions, and they can be used as vaccination. Schistosomiasis diagnosis, challenges, and opportunities for elimination. So this abstract highlights the importance of microscopy as one of the most important diagnostic tests. Now moving on to the MCQs. A 35-year-old man from a rural area in sub-Saharan Africa presents with abdominal pain, diarrhea, and blood in his urine. He reports a history of frequent exposure to freshwater bodies, where he offered bathes and fishes. Urine sample was collected and under the microscope, the presence of schistosoma eggs was confirmed. The patient was diagnosed with schistosomiasis. So given the clinical features in a geographical region, which type of schistosoma is most likely to be responsible for infection? A. Schistosoma mannsoni, B. Schistosoma japonicum, C. Schistosoma hematobium, D. Schistosoma mccongi, E. Schistosoma intercalatum. So the answer is Charlie. Number two is a 25-year-old woman living in a rural area in Brazil presents with symptoms of fever, fatigue, and abdominal pain, blood in her stool, reports frequent contacts with freshwater lakes while gathering water from household use. She recalls seeing a snail in water, which she occasionally uses for irrigation. A stool sample revealed the presence of schistosoma eggs. Which of the following is most likely transmission route for schistosoma in the case? A. Direct ingestion of contaminated water. B. Contact with water contaminated with cercarias. C. Inhalation of contaminated air. D. Consumption of undercooked snails. E. Mosquito bites in contaminated areas. So the correct answer is B. 3. A 40-year-old man from an agriculture community in Egypt presents with complaints of abdominal discomfort, fatigue, and bloody urine. He mentions that he frequently works in fields with irrigation canals and has often waded through shallow waters while cultivating crops. The patient reports seeing snails in the canals, and his urine sample shows the presence of schistosoma eggs based on his history and symptoms. The doctor suspects schistosoma infection. Which of the following is intermediate host responsible for transmitting schistosoma in this case? A. Fish. B. Freshwater snails. C. Mosquito. D. Amphibians. E. Crustaceans. Anyone? Okay, so the correct answer is beta, freshwater snails. So a 28-year-old man living in a rural area in sub-Saharan Africa presents with complaints of persistent abdominal pain, diarrhea, and blood in his stool. His reports regular contact with freshwater while swimming in river and lakes. The patient is suspected of having schistosomiasis, and a stool sample reveals presence of schistosoma eggs. Which of the following represents the infective stage of schistosoma that is responsible for the patient's infection? A. Meracerium. B. Cercaria. C. Sporocyst. D. Egg. E. Larva. So the correct option is beta cercaria. 5 is a 34-year-old woman from an endemic area in Africa presents with hematuria, dysuria, and pelvic pain. She reports a history of frequent exposure to freshwater bodies where she often gets swimming. On examination, she has a palpable bladder distension and tenderness. Urine exam shows schistosoma hematobium eggs. Which of the following is a common complication of chronic urogenital schistosomiasis in this patient? A. Hepatocellular carcinoma. B. Bladder cancer. C. Meningitis. D. Pulmonary hypertension. E. Esophageal varices. So the correct answer is B. Bladder cancer. So a 26-year-old man who recently traveled to an endemic area in Southeast Asia for a month-long camping trip presents with fever, chills, muscle aches, and a rash that appears 2 weeks ago. He also complains of abdominal pain and diarrhea. The patient has a history of swimming in freshwater lakes during his trip. Lab tests confirm schistosoma japonicum infection, and the physician suspects Katayama syndrome. What is the most appropriate treatment in Katayama syndrome in this patient? A. Albendazole. B. Praziquantel. C. Ivermectin. C. Mebendazole. E. Diethyl carbamazepine. So the answer is beta. So a 35-year-old woman from an endemic region in East Africa presents with complaints of hematuria, pelvic pain, and dysuria. She is also known to be living with HIV and is currently on antiretroviral therapy. So a urine exam shows the presence of schistosoma hematobium eggs, confirming a diagnosis of urogenital Schistosomiasis. The patient's CD4 count is 350 cells per cube, indicating mild immune suppression. So the doctor is concerned about potential co-infection with other pathogen. Which of the following is a potential co-infecting agent in urogenital schistosomiasis in this patient? A. Neisseria gonorrhoeae. B. Plasmodium falciparum. C. Mycobacterium tuberculosis. D. Human papillomavirus. E. Chlamydia trachomatis. So the correct answer is Delta. 8. A public health official in a country with a high burden of schistosomiasis is planning to implement a mass drug administration campaign to control the disease. The country has a significant number of affected individuals living in rural areas with limited access to healthcare. So, this official follows the World Health Organization for schistosomiasis control using praziquantel. Which of the following is the most appropriate regime for mass drug treatment in the scenario according to WHO guidelines? A single dose praziquantel for all individuals over 5 years of age in endemic areas. B. Weekly praziquantel administration for high-risk individuals. C. Annual praziquantel treatment for all individuals in endemic areas regardless of age. D. Biannual praziquantel treatment for individuals under 15 years of age only. And E. Single albendazole for all individuals in endemic areas. So the correct answer is A. 9. A public health team is preparing to implement a mass drug administration campaign to treat schistosomiasis in rural area where the disease burden is high. So the team plans to distribute praziquantel to all individuals aged 5 and above, focusing on communities with limited access to healthcare services. During the planning stage, several challenges are identified that could potentially impact the success. Which of the following is most significant challenge in drug treatment? Number A, limited availability of praziquantel and inadequate distribution infrastructure. B, the development of rapid drug resistance. C. Effective treatment for all individuals, including those with comorbid conditions. D. Difficulty in ensuring complete compliance with treatment due to cultural beliefs and stigma. And E. Lack of trained healthcare workers to administer the drug. So the correct answer is A. Limited availability of praziquantel. 10. In a rural community located near a freshwater lake, schistosomiasis is endemic and the transmission rate is high. So the community frequently uses the lake for bathing, washing. The health authorities are working to control the transmission of schistosomiasis with a focus on reducing the snail population, which serves as intermediate host for schistosoma parasites. So the health team plans to implement the snail control measures as part of the larger control program. Which of the following snail control strategies is most effective for reducing the transmission? A. Introducing predatory fish species that feed on snails. B. Using molluscicides to target snail population in freshwater lake. C. Installing barriers or fences around the lake or prevent people from having contact with contaminated water. D. Increasing the use of praziquantel to treat all individuals in community. And E. Encouraging the community to plant vegetation around the lake to naturally deter snails. So the correct answer is B. Using molluscicides to target snail populations in freshwater lake. This is the key to the MCQs. Here is the link to our YouTube channel where the presentation will be uploaded shortly. Thank you.